Mr. Parth. Mr. Parth is from Bangalore, right?
Yes, sir.
From Karnataka. So he's a young boy, aged 26. 26. So he's having all over thinning over here. And Mr. Parth doesn't want to take any medications or lotions for the hair loss and thinning. So he needs a temporary or something like a permanent solution to just cover this bald patch or the scanty area. Just you can focus is over here. This is the area. It is bit over from the center you can put. Fine. See, you can just see this area is bit thinning, right? So Mr. Parth, as he is 26 years age, so he needs a good hairline, which is little bit more prominent in the temporals as well as in the hairline part. So right now we will proceed for designing the hairline. So prior designing the hairline, I will tell what we are going to do is scalp micropigmentation. So within these areas where you are seeing the minute miniature hair follicles, we will be just doing the pigmentation of a tattooing, or you can say as an scalp pigmentation or scalp micropigmentation. So we will be using certain dyes which are a bit skin friendly. So right now I would be designing the hairline. I don't need to do any measurement for this because he already has got an hairline, but it is a bit thin in either of the sides. Fine. These are the two temporals which we had created. Right now we are proceeding for the frontal hairline. So I am lowering the hairline a bit till 0.5 centimeter, as Mr. Parth wants it to be a little bit lowered. Just have a look of the hairline, Mr. Parth. As you insisted, we had just done a bit V-shaped hairline.
Yes,
okay.
Yes, perfect.
Perfect.
Yeah.
You're happy by the hairline?
Yeah, seriously.
Okay.
Yeah.
So what our main motto would be to doing more denser over here in the temporals and also in the front and this forelock area. This is known as the forelock, in which he has got a bit of more thinning. And this hairline which we would be creating would be little bit of zigzag hairline, which I will show you once the scalp micropigmentation has been done. Okay, so our main concerns will be to fill this whole of the areas. Prior preparing for the scalp micropigmentation for Mr. Parth, we had just trimmed a bit of hair from the temporals and as well as the occipital areas and all over. And we had done a surgical scrubbing to the scalp so that the scalp becomes a bit more hygiene and oil free area, so that all the dye and everything would be a little bit more static and perfect. So right now we will be proceeding for the photo session. Mr. Parth, right now you can just sit a little bit. You can straight towards right side. We are done with the photo sessions. Right now we will be taking Parth to change the top or the shirt. Come.
Second.
So this is the machine which we will be using for the pigmentation, and these are the pigments which you are seeing over here, and this is the probe which has got the needle in it. So this needle is a 3 RL needle. So this needle will be having 3 different needles, so that it gives you more denser look while you do the scalp pigmentation. And here is a bit of NS, normal saline, and this is the Vaseline which we use it to make the skin a little bit smoothie, and it removes the excess of dye or the pigmentation which is settled. And these are the dye, and these are the dye stands which you are watching over here. You can keep the dye over here while doing the pigmentation. So this has got different settings, like over here you can focus it on the machine, This machine has got different solutions like in the brow, eye, lip or medical pigmentation. We will be going to the medical because we will be doing it on the scalp. And for the brow, eye and lip, there are different, you can say the speed of the machine or the motor. So right now we will be going for the medical one. So prior to that, you can see we had kept the patient in the position and the low light illumination over this area. Right now we would test some pigment and we will see something. So right now we are applying a bit of Vaseline over it. We had already started with the pigmentation procedure. I'm just focusing the light over the pigmentation area where we are doing the pigment. Speed is fine. Okay. So here we had completed the SMP of scalp micropigmentation of Mr. Parth. So you can just see the temporal hairline and the frontal hairline and whole of the forelock and everything has been filled with the pigments. Fine. So you can see even the behind, you can see the top wave as well. It is evenly distributed throughout. This whole area is totally pigmented, and the shiny which you're seeing is due to the glycerin effect which we use during the scalp pigmentation. So this will gradually go off once he pours some water or anything. So right now we don't insist him to pour some water or do any shampoo for 2 to 3 days. Okay, fine. So only normal you can apply a little bit of 1 drop of oil and all. Okay, because your skin will be getting little bit moisture effect and all, and the pigment will also be static. And post after 7 days or after 5 days, you can have some Johnson baby shampoo, mild shampoo, and then foam it and then apply it. Post that you need not to apply any oil or anything. Okay. So how did you feel regarding the treatment and all?
Before I walked in, I had doubts about the actual procedure. I didn't think it would be so good. The procedure that I've undergone now is seriously good. The hairline that I expected, the doctor gave me that, and the density is even throughout. I am seriously happy with the procedure, and the standards are world class. HH5 is best in India for SMP.
So you came so far from Bangalore, right?
Yes, sir.
So just you can see the pigments and all. Fine. So right now I will be clicking some images and I will show you the behind and all the sides.
Sure.
And we will compare the images which we had taken in the morning as well, so that you can differentiate it. Okay, thank you.
Thank you.